Welcome to Science Talk with China Daily. I'm your host, Zhang Zhihao. It has been a trying time for health workers in China as the country grapples with its biggest COVID-19 challenge since the early days of the pandemic. As of March 31st, 28 provincial-level regions have seen a resurgence of new cases, many of which were caused by the more transmissible and elusive Omicron variants. With over 60,000 cases reported on the Chinese mainland last month, people are debating again whether China should pivot from its dynamic zero-COVID strategy. But before we can take such a step, we should ask ourselves, what are the consequences? According to the Chinese Center for Disease Control and Prevention, if China adopts the control and prevention strategies of the United States, the country will register more than 630,000 daily cases, with over 22,000 severe ones. And this is considered the most optimistic estimate. If China were to follow the United Kingdom, France, or Spain, the number of daily new cases will be in the range of several hundreds of thousands, of which over 10,000 will be severe. Researchers estimated that last year there were only around 4.3 intensive care unit beds per 100,000 people in China. Can you imagine the devastating impact a rapidly burgeoning number of critically ill patients would have on China's medical system and society? Moreover, booster shot coverage for China's senior demographic is still relatively low. As of March 17, around 56.4% of people aged 60 to 69 had received a follow-up shot. This figure was 48.4% for those aged 70 to 79 and 19.7% for those above 80. With a weaker immune system and underlying health conditions, the elderly population runs a significantly higher risk of experiencing severe symptoms and mortality compared to young adults. Even when facing the relatively less severe Omicron variants, the risk is still high. This is why China is doubling down on its time-tested dynamic clearance strategy that emphasizes early detection, reporting, quarantine, and treatment. Its goal is to quickly and accurately cut off the transmission chain before an outbreak gains momentum and leads to major disruptions in social and economic activities. The zero-COVID strategy hasn't prevented cases from happening, but when carried out properly, it has stamped out dozens of local outbreaks across the nation, regardless of strain mutations. Each flare-up has typically taken about a month and a half to be put under control. Of course, there are bound to be social, economic, and medical causes for these epidemic control measures. The highly infectious Omicron variants also pose new challenges in our fight against the overall pandemic, one of which is a high proportion of mild and asymptomatic cases. To address these issues, the National Health Commission updated its national diagnosis and treatment guidelines with measures including stronger early detection and more optimized treatment plans and hospital discharge requirements to ease the strains on the medical system. Chinese experts have routinely stressed that the zero-COVID policy is not set in stone, and it will change under different circumstances. So the million-dollar question remains, when will China change its zero-COVID policy? To answer this question, it might be helpful to learn about how China dealt with another highly contagious respiratory disease that has a prolific body count. It is called tuberculosis, also known as the White Plague. The World Health Organization estimated that China recorded over 840,000 new TB cases in 2020, making it one of the highest TB-burdened countries in the world, along with others like India and Indonesia. Yet in 2019, China's treatment success rate for new and relapsed cases was 94%, and it had a mortality rate of 2.2 deaths per 100,000 people, which is on par with those from developed countries. China can tame TB because the country has very potent vaccines, a highly vaccinated population, a plethora of accessible treatment options, and very detailed quarantine measures for confirmed cases. As for the COVID-19 virus, scientists are developing inhaled and nasal spray vaccines that can boost our upper airways' mucosal defense against the pathogen, which may lead to reduced transmission. Meanwhile, researchers are working on broad-spectrum antiviral drugs that may work on a variety of COVID-19 strains. Case tracking and quarantine measures are also becoming more efficient with the help of big data and other technologies. As vaccinations, treatments, and quarantine measures improve in the future, it is very possible that China may adjust its COVID-19 policies. But the country wants to do it scientifically, responsibly, and at its own pace. Only then can it ensure that the rights of its people are valued and protected. Thank you for watching. Stay hungry, stay humble, stay curious. Until next time.